Namaskar everyone. I, Vaidya Sagar Phinde, Associate Professor in the Department of Kaumarbhritya, welcomes you all in ANCN Networking Channel, organized and managed by Institute of Teaching and Research in Ayurveda, Jamnagar, Ministry of Ayush, Government of India. So, we have seen in last lecture that what is the Kaumarbhritya subject means. Now, in any subject there are some jargons, there are some terminologies which need to be cleared, which need to be understood for better understanding and better rhythm to be captured in future lectures. So, let us see today. There are few terminologies. Most important terminology is word Bala. Bal Chikitsitam, there is a word by Harit Samhita. There are many places where Bal word comes. So, Charak Acharya has mentioned it very beautifully. What is Bal? They says that Tatra Balam Aparipakva Dhatu Ajata Vyanjanam Sukumaram Aklesha Saham Asampurna Balam Shleshma Dhatu Prayam Ashodasa Varsham. So, they says that Bal means till 16 years. This is one. Most important is this, you just remember it. I will tell you that what Chakrapani Acharya has commented on this, but for now just remember till 16 years. And then there says some characteristics of Bala. What are the characteristics of Bala? Aparipakva dhatu, ajata vyanjanam. Ajat vyanjanam means there is no development of secondary sex characters. So, what does it mean in other terms? If there is a starting of secondary sex characters development, then or completion rather, not starting, because starting also comes under the Bal only, but if there is a complete development of secondary sex characters, then they would not be considered as Bal anymore, though they did not complete at 16 years. So, this is how clinical characteristics are important. So, once again, Tatra Balam Aparipakva Dhatu, Dhatus are not Paripakva, Ajata Vyanjanam, Sukumaram. Sukumar is very important word, which is very important while we are planning some procedures. Certain procedures cannot be performed on Sukumar. So, Sukumar is the one most important characteristic of Bala. Akleshasaha, they cannot withheld or they cannot sustain with very much stress or difficulties while you are treating them. So, that is why akleshasaha, asampurna bala, sleshma dhatu praya, they have a more sleshma during this age. So, this is word Bal means. So, everyone should remember this, Tatra Balam Aparipakva dhatu, Ajata Vyanjanam, Sukumaram, Akleshasaham, Asampurna Balam and Shleshma Dhatu Praya. These 6 characteristics are most important, and at the end they says Ashodasa Varsham, till 16 years of age. So, this has been given in Charak Samhita, Vimansthan 8, while they are describing about Dashvid Pariksha, in which one is Vaya. So, Amar Kosh has mentioned few more definitions or few more terminologies. According to them, Bal is 0 to 5 years. Then Paugand, Paugand is the term given for the babies of age 5 to 9 years according to Amar Kosh. Keshor, Keshor means 9 to 16 years, and Yovana, Yovan is above 16 years of age. So, these are the terminologies given by Amar Koshka that can be remembered. Academic purpose is there to remember this, otherwise the clinical implication is better understood by that Charak Samhita's reference of Bala. Parashar Samhita has given a female specific terminologies, like up to 8 years they have said the female babies should be considered or called as a Gauri. Then Rohini means above 8 till 9 years, 8 to 9 years is Rohini. Kanya is above 9 to 10 years, it is called as a Kanya, and Rajaswala means more than 10 years. So, this is also important, this word itself give the idea about its characteristics. So, this is important terminologies which to be remembered. Of course, These are from Amarkosh and Parashar Samhita, that should be remembered. Arogya Raksha Kalpadrum is one textbook which is very famous in South India, specifically Kerala, for pediatric treatment only. And there are many chapters and there are many terminologies. Few terminologies are like Jata Matra. They have mentioned that Jata Matra means immediately after birth. Even Ashtanga Hridayakar has also mentioned that Jat Matra Vishodhyalba Balam Sendava Sarpisha. So, what does it mean? That immediately after birth, baby should be cleaned with Sendhav and Sarpi for Ulbashodhan. So, in Ashtanga Hriday Uttar Tantra 1 they have mentioned this. So, Jat Matra means immediately after birth. This terminology is very important to be understood. Jat Matra means immediately after birth. And then in Arogya Raksha Kalpadrum there is Panchatita, means 15 days after birth, Ati Panchatita 1 month after birth. This is how they have given a treatment according to the age, and that is why age classification is most important to identify the dose and the procedure which are suitable for that particular age of child. Now, there are few definitions or terminologies in modern counterpart as well. So, what is live birth basically? Which children we will say that they having a birth with life. So, they says that the complete expulsion or extraction of a product of human conception from its mother regardless of pregnancy duration. So, gestational age is not important, but expulsion and extraction of conceptual material is important. After separation, breathes or show signs of life. This is important. If after separation that baby breathes or shows any signs of life. What are that signs of life? That is heartbeat, umbilical cord pulsation or definite voluntary muscle movement. If baby starts moving their arms and legs, then also it is a signs of life. So, it does not require the umbilical cord to be cut or placenta to be detached. Okay. So, this is called as a live birth. If you want to certify that yes, baby delivered live, then these are the criteria. The signs of life if you have seen after birth, after expulsion, then you have to tell that yes, this is live birth. And on the contrary of that, what is stillbirth? A baby who dies after 28 week of pregnancy, but before or during birth, this is important, before or even during birth, then it is classified as a stillbirth. Okay. There are nearly 2 million stillbirths every year, one every 16 seconds. So, stillbirth is very grave issue, and that is why we should not be very ignorant towards this. So, stillbirth is during or before birth. If baby dies and do not show any signs of life, then it is considered as a stillbirth. So, live birth is important terminology. Stillbirth is one another important terminology which both are counterpart of each other. There are some terminologies related to gestational age, but before that we must know that what is gestational age. So, gestational age is typically measured in weeks from the first day of the woman's last menstrual cycle to the current date of pregnancy or to the delivery. Okay. So, at the point of time while you will start counting gestational age, you have to start with the first day of the last menstrual period. So, first day of LMP, starting is this, and the last one is current date or at the time of delivery. So, as per gestational age, there are few terminologies which are most important clinically. So, first one is preterm. What is preterm? Baby delivered before 37 completed weeks of gestational age. 37 weeks are not completed, and before that if delivery took place, they are called as a preterm babies. Okay. Then there is a term babies. So, baby delivered between 37 completed week and 42 weeks of gestation, they are called as a term baby. Previously this was considered as a full term, but now according to newer guideline, this term is further divided into early term, full term and late term. So, basically all these term babies are considered as a normal and they have a least possibility of any medical illnesses or medical complications, and that is why they are called as a term baby. But in them also, if you have a choice of having a caesarean section, then you have to choose the full term period. That is why they have divided this into the 3 segment, that early term is not to be chosen if you have an option to go for the full term delivery. Why? Because they have seen in the many researches that early term baby, the baby delivered during the early term, they are having a more chance of developing some medical complications than the babies delivered during the full term. So, though early term is also better than the preterm, but full term is the best optimal period to having a delivery if one has a option to select. So, baby delivered before 37 weeks is considered as a preterm, 37 weeks through 38 weeks 6 days. This is most important. Here gestational age is counted in weeks and days. Okay. So, 38 weeks and 6 day is a period during which the baby delivered, then it will be labeled as a early term. 1 day then after is considered as a 39 weeks. So, 39 weeks through 40 weeks and 6 days. So, after 40 weeks 6 days is also considered as a full term, and 41 weeks next day is considered as a 41 weeks through 41 weeks and 6 days. So, ultimately 6 days of period is considered as a late term, but as a whole this all called as a term delivery, term gestation, and post-term means more than 42 weeks of gestation. These are called as a post-term gestational age. So, just like related with gestational age and related with the gestational weight also, there are some classification and terminologies. So, one terminology is small for gestational age, which is called as a SGA. So, basically weight below 10th percentile of gestational age is considered as a small for gestational age, and appropriate for gestational age means the age between 10th to 90th percentile of that particular gestational age is considered as a appropriate for gestational age. Large for gestational age means what? The 90th percentile and above, if the weight of that particular baby is there for that gestational age, then it will be considered as a large for gestational age. So, basically what is this percentile? 10th percentile, 90 percentile. So, we have to plot a dot on a chart in which gestational age is mentioned on a x axis and on y axis weight is available. So, we have to put the dot on the chart and see whether it is lying above 19th percentile or whether it is lying below 10th percentile. If it is so, we have to define it as a either large for gestational age or small for gestational age, and if it is in between, then appropriate for gestational age. This is how these terminologies are being used. Why these all terminologies are important? Because the deviation from normalcy, whether it is upper side or lower side, will having a implication of more chances or more possibility of clinical manifestation of various type of diseases. That is why we have to mention in the case paper, we have to understand whether it is a normal or abnormal. If abnormal, whether it is on a higher side or lower side. So, according to birth weight, there are few terminologies which are frequently used in clinical practices. One is normal birth weight. Normal birth weight is text to text, nation to nation, and considering the different guidelines, there would be some differences, but generally 2.5 kg to 4 kg is considered as a normal weight, or in some text it is 2.5 to 3.5 kg. Here we will take 2.5 to 4 kg as a normal weight for a baby who has delivered just now. So, what is then low birth weight? Low birth weight, of course, less than 2.5 kg is considered as a low birth weight. Low birth weight can result from preterm birth, not always, but majority of time it is because of preterm birth or intrauterine growth retardation, which is called as IUGR, or maternal health issues and is linked to higher neonatal morbidity and mortality. So, low birth weight is to be taken care. Less than 2.5 kg of weight at the time of birth is considered as a low birth weight, and there are many reasons for that. But the treatment or care is required more in comparison to normal weight babies. Low birth weight further divided for the severity into two segments. One is very low birth weight. Very low birth weight means the baby delivered with birth weight of 1 kg to 1.5 kg. So, this is called as a very low birth weight babies, and infants may require specialized neonatal care and monitoring for growth and development by sure. In this babies, the monitoring for growth and development is most essential. Why? Because there is many chance that their brain will impact because of the hypoxia or ischemic condition, and that is why taking a close look of their growth and development is most essential if baby delivered with a very low birth weight. And even worse condition is considered as a extremely low birth weight. Okay, the baby delivered less than 1 kg of birth weight is considered as a extremely low birth weight, often associated with preterm birth and high risk of complication including respiratory distress and infections. So, that is why this terminology is most important. Once again, let us revise: normal birth weight, then low birth weight, then very low birth weight and extremely low birth weight. So, these all are the weight related terminologies, and of course, high birth weight, or there is one terminology macrosomia, if baby delivered more than 4 kg of weight. And if baby delivers with more than 4 kg of weight, then we have to check that whether mother has a diabetes or there is a high risk of birth injury in these patients, and metabolic complication could be there in such kind of patient. So, this we have to check very meticulously if we come to know that some baby has delivered with macrosomia. So, this all are birth weight related terminologies which any pediatrician should understand. So, thank you once again. These are few terminologies which we need to understand during the Kaumarbhritya subject. Thank you.